Howdy, y'all. We're going to call to order our meeting of the Compensation Committee. I guess we don't have a quorum, do we? Or need to call for a quorum. Do we have any public comments?
No public comments.
No public comments? Okay. Does anybody want to make it? Nobody ever does. Okay. So moving on to item number 1, the presentation and discussion of the Brownsville Public Utilities Board Group Health and Dental partially self-insured plans requested for proposal, summary, and recommendation. So,
We're up, sir. Good afternoon, Chairman, board members. My name is Sergio Delgadillo. I'm the Division Manager for Administration, reporting to the Human Resources Division. Can you all hear me fine?
yes, yes, sir.
Yes, thank you. So before we get into the specific of our RFP process, I'd like to start with a quick snapshot of our current healthcare insurance landscape. So the market continues to see upward pressure on premiums driven by raising medical costs, specialty pharmacy expenses, and increased utilization. Employers are placing greater emphasis on plan designs that encourage preventive care, integrated wellness programs, and employee advocacy services to help control long-term cost. Of course, in this environment, stability, strategic use of data, and proven cost management strategies are more critical than ever. Just as a snippet of information, chronic conditions contribute to 90% of the trillions spent yearly on U.S. healthcare, and billions in annual employer losses due to absenteeism and loss of productivity. So again, preventive health measures and a company culture, encouraging them, it's crucial to reducing employer health costs. So employee health and dental benefits are critical components of our comprehensive compensation package, not only to safeguard the well-being of our workforce, but also to drive organizational success. By providing access to healthcare and dental services, we help our employees stay healthy, we minimize absences, and we improve overall productivity. So these benefits are key in attracting and retaining top talent, which fosters loyalty and satisfaction. I know every time I stand up here, I talk about the same, so this is very important to us. So to walk you through a quick summary, with that context in mind, let's review our RFP timeline and process. We launched the RFP on February 24th, 2025, with the goal of ensuring competitive pricing, strong plan performance, and alignment with strategic objectives. We reach out to 12 vendors. We aim for best-in-class services with emphasis on maintaining the same level rating as current, yet ready to hear alternate solutions from accountable care organization models to other insurance plans, for example, an HMO, or a high deductible plan, or a manageable care plan. So just kind of what's out there, how can we improve our offering, how can we manage cost? We're looking for an integrated administrative services only, also known as ASO model, rather than a third-party administrator. ASOs it's a standardized approach, offer integrated services, so that means that they can manage the whole cycle of our employee health care. So we receive responses from vendors. Each vendor was evaluated based on financial competitiveness, network coverage, wellness, advocacy capabilities, claim management, and overall service delivery. Our analysis incorporated both quantitative factors like the cost projected, claims, rates, and then also some qualitative factors such as vendor service, history, and innovation in plan management. A crucial component that I'd like to highlight is medical and pharmacy disruption, because of course, when evaluating a health plan, we are looking a lot into how this is going to affect our employees. So that would be what providers would remain on network should we choose plans or change any plans. So that was a very important component, which is going to take us to our next process. From the initial pool, several vendors stood out. They have good presence in the community and the ability to meet and exceed our services. We looked closely at their provider network. We looked closely at the disruption report. We looked at their estimated claims and see who could support our workforce. We looked at their implementation capabilities. Their footprint in our area was important, and that's how we arrived to this baffle participants. So we narrowed the field, and we entered into our best and final offer process with the 2 top contenders, that is the ones that had the best pricing and less disruption. So the result was 2 highly competitive proposals. We have Blue Cross Blue Shield Texas They are our current provider, with whom we have a strong and long-standing, we have a long-standing relationship. And then you have United Healthcare. That would be a new provider. They have strong offerings. We just don't have historical data with them. So before transitioning to the cost summary from respondents, I'd like to briefly just highlight our employee health benefits package. Of course, designed to support a comprehensive care. Our plan includes a deductible of $500 for individual and $1,000 for families. This has to be met before insurance coverage begins. Sorry, that's wrong. Before insurance coverage begins, that is correct. Co-payments are fixed at $10 for telemedicine, $30 for regular doctor visit, $40 for specialty, $50 for urgent care, and $300 for emergency room visits, with prescriptions costing $10 and $20 depending on the medication, either generic or brand. After meeting the deductible, co-insurance applies, meaning that employees share a percentage of the cost. The plan also features a maximum out-of-pocket, which caps the annual expenses for covered services. When reached, 100% of the plan is covered for employees. So let's move to the fun stuff of the RFP. So comparable administrative rates. Both Blue Cross Blue Shield and UHC offer similar overall administrative costs, despite labeling components differently. For example, while UCH includes services like fiduciary, advocacy, and telehealth bundle into their included rate, Blue Cross Blue Shield itemizes this separately. However, the total per employee per month fees are very close. You can see that we land at $63.43 and $67.17 for UHC, indicating very comparable cost. That is the administrative services only cost. Then we jump to a big other bucket, which is the claim experience estimate. So though each vendor provided their own claim projections, the most reliable estimate comes from our consultant, Alliant. They have a very robust analytical team, and they deliver a unified PPO claim projection. So rather than banking on what they were thinking or plan was going to cost, they ran our numbers. They have 3 years of history, and they came up with a $1,392 per employee per month for each vendor. So what's the base that we use. Really, the deviation between what we had from one and the other were very similar, but we trust that this number was going to get us to a better decision-making point. And then the last component has to do with wellness and enrollment credits. UHC offers a mature credit totaling $381,000 over 3 years. Blue Cross Blue Shield is offering $246,000 as a proposed credit. So of course, we're getting a little bit higher credit from UHC. That is money that is available to us to use for wellness mainly, but you could use it discretionally to pay also even for fees within the program. So of course, this credit could potentially offset some of the costs that we have upstairs, but we're just labeling as it is as a credit that was offered.
The INC means included?
Yes, sir.
Okay.
That's what it means, included.
And no additional cost?
Yes. Yeah, so you can see that they break the prices differently, but they arrive to kind of the same cost. So while the price difference between the two is negligible, the cost of change is significant. That's what this slide is highlighting that was provided consultant. So our current provider brings multiple years of claim data, enabling accurate trends and analysis and predictive modeling. That helps our awareness program, provides wellness initiatives and advocacy programs that have been tailored to our population, and they have a strong service history and confidence in claim and cost projection. So switching provider would involve some onboarding risk, potential disruption to members, and most importantly, loss of historical data. Now, at the beginning of the presentation, I mentioned that employers are increasingly focusing on plan designs that promote preventive care, integrated wellness programs, and employee advocacy services as strategies to manage long-term costs. So this is just an example of the exercises that we're pulling there, kind of showing the overlapping between networks. This is only Blue Cross Blue Shield that we're showing. That's the current vendor, that information that we had access to. But it shows how we could potentially bring another type of plan, not that we're recommending, but just some of the alternatives that we're looking into. Potentially, once we enter into an agreement, we can get solid rates on other plans or platforms that we can use. So based on our analysis, while both finalists are capable of strategic advantages of retaining our current provider Retaining our current provider really outweighs the minimal potential savings from changing carriers, and the savings are related to the credit. Staying with our existing vendors ensures continuity, maintains our data-driven approach to wellness and claims management, and minimizes disruption to our employees and their families. Changing vendors does present an opportunity to test other service providers, but there's really no compelling reason to take that risk. The current provider has demonstrated consistent performance, alignment with our organizational goals, proven ability to support our evolving needs. We only have a great feedback from our employees regarding Blue Cross Blue Shield, and as we also poll some of our neighboring cities, we receive the exact same feedback. We're getting great service from our employees from Blue Cross Blue Shield. Our consultant, Alliant Insurance, is recommending BPUB awards the contract to Blue Cross Blue Shield. BPUB staff recommends the selection of Blue Cross Blue Shield as an integrated administrative services only provider for employee and health dental, and we are requesting from this committee to move forward to the full board.
So, I don't know, do you guys have questions? I have a couple.
Yes, sir.
First of all, so we see a savings of 140,000. What is that percentage-wise over the entire, cost of the plans?
The total cost is around $12 million,
Okay.
roughly around $12 million, so 1%?
Okay, so it's good to have that as a reference. Now, one of the other things is, what kind of providers would we expect with the other plan?
So while
Have
we
done a
were,
comparison?
Sorry?
Do we have a comparison? Can we go head-to-head with that?
we did aim, so you can see that we started this process early in the year, and we've been trying to, with a fine comb, understand better the options that we have. Really, I was not able to get an exact list of providers. What we got is a geospatial report, which tells us that we have certain coverage within certain miles from our employees, ranging between 0 to 45 miles. You'll get this many vendors or doctors. Their promise is the disruption is 99% around, so that's why they made it to the VAFL, because they're saying that we pretty much have very good overlap in between the providers that we're using and the providers that they offer.
Okay, so let's ask this. Besides the idea that we've been with Blue Cross Blue Shield, which, by the way, I have my insurance through in Massachusetts, why else did the consultants recommend these folks?
Blue Cross Blue Shield?
Yeah.
So one of the major emphasis that they saw, and the emphasis in the introduction that I gave to this presentation, was the wellness component. Really, that's what's going to help us lower long-term our rates. We need to make sure that our employees are healthy, and they carry years of historical data that can help manage that process. Last year, and maybe echoing that initiative, we partnered with 4 wellness providers in Blue Cross Blue Shield that now are being offered to our employees. We have Omada, for example. We have Wellness, WonderWealth. We have Hinge Health. I'm missing one.
Well, here's an important question.
Yes.
So these wellness providers wouldn't be available with the other health insurance group, UHC?
Yeah, well, we asked the question directly. I think they have their own providers. They just don't have the data that can help us support better. That's what we believe to be true.
So my one fear is locking ourselves into one vendor from now till forever just because they have more data. I mean,
Just to echo that, actually my approach when we're doing this RFP is see what's out there and that's better. Last year we did an RFP for supplemental services. We changed all of them. So changing is not a problem as long as we see it as a benefit to VPUB and to its employees. So we're actually looking to a fine comb and understanding the services so we could maybe shift if we were to see something better. We just couldn't see that ourselves either. We found that the offering, we also, as I mentioned that we polled other cities do use UHC, and we heard mixed comments. Well, not necessarily negative, we heard both. We don't hear that with Blue Cross Blue Shield. They manage their claims, they get the help that they need. They don't have to be fighting so they can get a claim approved. So very transparent, very easy to manage. So all that shifted our decision points in making into recommending this to you all today.
Okay. Any other questions? And I guess the request is that we recommend, we don't take any action at this meeting, right? Yeah.
The request is that we can move it to the full board for
Okay.
approval and to authorize our manager to enter into a contract.
I think so. I think, yeah, the one request I would have is just if you add a little bit more feedback about each plan from our consultant, you know, just saying, hey, we have experience with these guys and they hassle your employees more for whatever reason. It would just be nice to have that. But, okay, sounds great.
Thank you, sir.
And now, moving on to item number 2, the presentation and discussion of the Brownsville Public Utilities Board Group Health and Dental Partially Self-Insured Plans and Rates for Policy Year 2026. Sergio.
So for the purpose of the meeting, my name is Sergio Ledillo, Division Manager for Administration. Good afternoon, everyone. And this is an item that pretty much piggybacks to our previous item. I'm going to walk this really fast, so you know why we're doing this, and we know how important this is for our employees and to mitigate and ensure organizational success. So the insurance plan follows the calendar year, beginning January 1st, ending December 31. Employees, BPU has a partially self-insurance health plan. This means that up to a certain point, BPU pays for the employee's health claims directly, rather than paying for a fixed premium to the insurance carrier. Added with a stop-loss insurance to protect against very large claims, $200,000 would be our case. So this approach gives BPU more control over healthcare costs and flexibility in the design of the plan that meets our needs. So it helps us manage cost. We are in our last year of our 3-year contract period currently, and we've gone through the market to see what other options we have, and we just provided you with a best option that we believe to be true. Now, the slide that I have here, it's our fund balance status. So when I say we're self-funded, that means that we do have a fund that helps us retain and maintain cost. And you can see a decrement in between August 2022 and then July 2025. So cost of insurance has been rising. This fund is made of VPUV and employees' contributions, and of course the disbursements to cover claims and fixed cost. Over the past years, you may see that our contributions have not been aligned as expected. 2024, we anticipate a 14-15 increase based on the renewals, based on the claim experience. However, we attribute this to, you know, the emerging out of COVID. People were catching up with their services. While we saw this in 2023, for example, we noticed that 2022 was a year where we were able to maintain costs. There was little usage. So we thought this was just a one instance. 2025, we anticipate a 26% increase to account for the previous year and the estimated claims. However, we proposed a 20% because we do have a retiree fund, and we figured that we could get a reimbursement and help our fund. However, you can see that keeping the same range of contributions and disbursements is not sustainable and would eventually deplete our fund. So on our left, you can see the expected claims and fixed costs for our plan year 2026 at around $11.9 million. We've taken very positive steps. I just mentioned earlier, one big one is building win-win programs for employees. We strengthen our wellness programs with preventive care services, and we're sure that in the long run, that's going to help us, of course, help with costs and chronic conditions. Nevertheless, you can see on the right side that the funding requirements are considerably higher by around $700,000. So this translates to funding slide. So in connection to that analysis, this slide is going to provide you a detailed breakdown of the fund's composition. On your left, you can see our current rates and our current composition. For this year, we're also bringing up a new rate, a new tier. We have a 3-tier rate. Currently, we're proposing a 4-tier rate. Our consultant did an analysis, and he actually pinpointed something that is very true. with having an employee plus one only rate, we have employee and a child or employee and a spouse paying for the same rate. So that would be a cross-subsidy, if we want to call it. So what they're sharing is, you need to make sure you have 4 rates. That is very typical in the market. We actually saw it in the renewals that we've been seeing from Blue Cross Blue Shield, and we thought it was a good timing to do that change. So on the right side, you can see how we're proposing several increases that is going to help us create that funding that we need and get us in a better shape for next year. So we're proposing an 11% to employee-only rate, and then an 8% for employee and child. That would be the new rate, 13.5 for spouse, and then 19.5 for employee and family. That will take us to a coverage of $12.025 million, which would be enough to cover the estimated expenses that we have. I can move forward. So on the left, you can see the current rates and the proposed rates. On column D and column E, you'll see the contributions that each one of us is going to be making, how it's going to impact our employees. So if we look at the biweekly, we can see that for employee only, somebody has not elected, BPB covers that benefit, and the increase will be 0. For employee and child or children, the increase biweekly would be $8.53. Employee and spouse biweekly $14.48, and then employee plus family would be $33.55. Now, I'm going to go a little bit depth into some funding requirements and rate structure just in a minute, but this gives you a picture of what we're seeing. So to arrive here, one of the things we've done is that we standardize our how we're subsidizing our employee's share. So you can see that we're paying for 100% of the employee on the left column, and then when it comes to dependent, there's an 8.07 increase there, and then for employee, a 7.9. So the reason there is we used to have a 61.47 subsidy, and we're moving it to 61.5. So that's helping a little bit mitigate costs for the employee. And the main concern was benefits erosion. So we are seeing that there's a COLA coming up, but at 11% versus a 2.3% COLA increase, was not apples to apples, was going to erode that benefit. So we figure we need to create a strategy that could help us mitigate some of that. The next rate is kind of the same. We have the same ratio. We just standardized to 61.5. But when it comes to family, where we saw employees ratio in between pay and benefits different, we also did that strategy of standardizing to 61.5. So that's a change to our structure. We're increasing the subsidy by around 1.3. And what you can see there, it's a different subsidy now for this year, and then next year is going to be the same. You're going to see the same increase across. Granted that we are looking for other options and plans that could likely kind of reset the slides to new options as soon as next year. What this does is that while before we had, if we don't do this change and we keep the same ratios that we had around 43 employees where their COLA was going to not cover this increases. This would mean an increase of around 4% to some of them. With this strategy, it minimizes to 4 employees who would see an increase higher than 2% in their premiums versus their annual pay. So that was the approach that we took, and that's how come we're here today and showing you these rates. This just shows kind of the breakdown of all the rates. We've gone through those and how they impact. And on the left side, you can see exactly how many employees we believe are going to be subscribing to each one of those plans. May I continue? Perfect. So when we move into the dental, that story is a little bit different, way happier. We've seen that our fund is very healthy. We've managed our cost. In 2022, we made a very positive change to our benefits in the dental side. We did improvements. We increased our maximum from $3,000 to $4,000. We removed waiting periods for endodontic, periodontic, crowns, inlays, overlays, and with no change in rates. And the planned expenses have really behaved really well to where we see that there's no additional funds needed for this plan. We're recommending we keep the rates as we have them with no changes. So funding, we're going to end up with $8,000 positive. We're going to fund to a better place. Participation, we don't foresee a change. And with that, I would end my presentation.
Any questions? I think we're set.
Gotcha. So BPB is recommending that the adoption of the proposed rate structure for 2026, and we also request to move this forward to the full board.
Absolutely. Sounds good. Sounds good.
Thank you so much.
Thank you. Thank you. Now, it's time for discussion and/or requests for future agenda items.
Yeah, I don't have any.
Okay, I guess I will entertain motions to close the meeting.
Motion to move?
All in favor, say aye.
Aye?
Aye. Meeting's adjourned.
Thank you.